at Renew, you always want to focus on renewing that smile and getting you more permanent solution. There's 3 different types of ways you can restore teeth that are missing. You can do the conventional denture method, you can do the snap-on dentures, or you can do a fixed arch, which is all-on-4 that we used to do. When you have conventional dentures, they're quite limited. They look great. We have better materials these days, but they have only 10 to 30% biting force of natural teeth, 10 to 30% stability. So different things can dislodge the denture, whether you have a sticky food or if you have a smaller bone, and the dentures won't stay in place as well. You need to use sometimes glue or have a good ability to control the dentures. When we lose our teeth, we lose the bone in our mouth. The bone continues to shrink, making it harder to wear dentures as we get older and as the longer the teeth have been out. To a snap-on denture, we have 2 or 3 implants typically put in the mouth. A very easy, straightforward procedure where now the denture has something to clip onto, especially the lower denture, which always moves around. There's no suction on that lower. So having a snap-on is a great introduction treatment to getting some implants and a permanent solution to bone loss. Implants stimulate the bone, so the bone doesn't shrink anymore. So we love to do implants not only because of the satisfaction it gives the patient on their prosthesis, it doesn't move, they can smile, they can eat whatever they want, the chewing power, but it also stimulates the bone so that the bone doesn't shrink anymore. Our most popular option and the one that we recommend is all-on-4. You can do this teeth in a day, or you can do a method where you put the implants on and then build the arch afterwards. But all-on-4 is pretty much a fixed prosthesis that doesn't come out. We typically build it on 4, 5, 6 implants, and it's something that is just a row of teeth. You have 100% chewing power, 100% bone stimulation, and it looks any way you want it to look. We cater our aesthetics to the preferences of the patient and make sure that you leave with a natural set of teeth in your mouth.